deal with an asthma attack. If a person thinks they are having an asthma attack, then they may consider taking the below actions. 1. If they're lying down, they need to sit upright immediately. 2. When sitting upright, try and start taking slow, steady breaths. Although this may seem easy for me to say, please try and stay calm, because panicking can make the situation even worse. 3. There is a need to try and manage the symptoms, so the reliever inhaler, which is the blue one, should be taken every 30 to 60 seconds. It's recommended that the maximum number of puffs should be up to 10. Emergency services should be called by dialing 999 and asking for an ambulance. If the person does not have access to their inhaler, or they have taken their inhaler, especially if the maximum of 10 puffs has been reached, and there has not been any meaningful control of the symptoms. If an ambulance has not reached the person within 15 minutes, it is important that they repeat step 2, which was to start taking their inhaler again, every 30 to 60 seconds up to a maximum of 10 puffs. Asthma attacks can become a life and death matter if they're not managed properly. Therefore, please do not hesitate to call for help in an emergency. The paramedic or medical team should ask for details about the person's medicines, and if they have it, their personal asthma action plan. If they can, they should bring this to the hospital. If a person's symptoms were controlled before an ambulance arrived, or if they had an asthma attack that was controlled without the need for calling an ambulance, they should still make an urgent same-day appointment to see their GP or specialist asthma nurse. There are some asthma patients that are prescribed a specific type of treatment called maintenance and reliever therapy, or MART, or symbiocourt maintenance and reliever therapy, SMART. The general information provided in this information presentation on asthma does not apply to patients who are receiving SMART or MART treatments. This group of asthma patients should follow the specific advice.